After more than 25 years as a physician, I've seen more pills, powders, and miracle supplements than I can count. But lately, there's something that really worries me. It's not a new virus, not a mysterious disease. It's the vitamin aisle at your local store. Those shiny bottles lined up under bright lights look harmless, even helpful. But let me tell you something most people don't want to believe. Some of the vitamins you're swallowing every morning could be quietly damaging your body. And the truth is, they've been lying to you. Yes, even your favorite trusted brands. There are at least 10 vitamins you should never, ever take, not because vitamins are bad, but because what's inside those capsules isn't what you think. You see, vitamins used to be simple. A bit of C from oranges, D from sunlight, B12 from food, the natural way. But today, we live in an era where everything is synthetic, mass-produced, and profit-driven. Behind the label, vitamin hides a world of chemicals, fillers, and false promises. Companies know you're scared of aging, tired of fatigue, and worried about memory loss. So, they sell hope in a bottle, the #1 anti-aging vitamin. The secret energy booster, the vitamin that reverses brain fog. But the truth. Some of these so-called health boosters are linked to heart problems, liver stress, and even increased cancer risk. And if you're over 50, your body doesn't metabolize these chemicals the same way it did when you were young. Let's start with the big one. Synthetic vitamin E. The label might say D-L-Fetocafero. The DL should set off alarms. It means it's made in a lab, not extracted from natural plant oils. Synthetic vitamin E doesn't behave the same way in the body. Instead of protecting your cells, studies show it can actually increase the risk of stroke and prostate cancer. I've seen older men taking 400 IU or more every day, thinking they're helping their hearts, when in fact, they're quietly damaging blood vessels. Natural vitamin E, labeled D-L-Fetocafero, is fine, but the cheap synthetic one, never. Then there's vitamin A, a fat-soluble vitamin your body stores in the liver. In small amounts, it's crucial for your vision and immune system. But too much, especially from synthetic supplements, is toxic. I once treated a woman in her 60s who came in with dizziness, bone pain, and hair loss. She thought it was aging. Turned out she was taking 25,000 IU of vitamin A daily from a skin and eyes formula. Her liver enzymes were sky high. Vitamin A builds up silently, and by the time symptoms appear, the damage is already done. Unless your doctor specifically tells you to take it. Don't eat carrots and sweet potatoes instead. Your body knows how to handle natural beta-carotene now. Vitamin B6. Yes, the energy vitamin. Here's something shocking. Too much B6 can damage your nerves permanently. You'd be surprised how many people come to me with numb hands or tingling feet, only to discover it's not diabetes, not neuropathy from age, it's B6 toxicity. Many energy or menopause supplements load up with 100 milligrams or more, way above the safe level. The body only needs a few milligrams. More doesn't mean better. It means dangerous. And once the nerves are damaged, they don't always heal. Then we have vitamin B3 niacin, once promoted as a cholesterol-lowering miracle. But high doses can cause severe flushing, liver injury, and even insulin resistance. There's an old saying in medicine, the dose makes the poison. Niacin is the perfect example. Used carefully under supervision, it helps. But as a daily supplement from a store shelf, a ticking time bomb. Let's talk about vitamin D, yes, the sunshine vitamin. I know this one's controversial. Everyone seems to be popping vitamin D pills like candy. But most people don't realize that vitamin D toxicity is real, and it's rising fast, especially in older adults. Too much D pulls calcium into your bloodstream, hardening your arteries and kidneys. I had a patient who came in with kidney stones after taking 10,000 IU a day, because a YouTube doctor said it boosts immunity. Her blood calcium was off the charts. The truth is, you only need vitamin D if your levels are low and only after testing. Blindly taking it can backfire terribly. Then there's folic acid, the synthetic form of vitamin B9. It's in cereals, breads, and almost every multivitamin. The problem? Your body doesn't always convert it properly, especially if you carry a gene mutation called MTHFR, and millions of Americans do. Unmetabolized folic acid builds up, confusing your immune system and possibly increasing cancer risk. The safer form is methylfolate, but of course, that one doesn't come cheap. Most companies stick to the cheap folic acid and call it good for your heart. It's not. Next is vitamin C. Yes, even the golden child isn't innocent. Large doses of ascorbic acid synthetic C can cause kidney stones, especially in older men. I've seen patients consuming 2,000 milligrams or more daily because they read it prevents colds. Doesn't. What it does is acidify your urine and push your kidneys to the limit. Your body can't store vitamin C. You just pee out the excess. But the stress on your kidneys stays. Want real vitamin C? Eat citrus, kiwi, or bell peppers. Nature already packaged it right. Then we have biotin, the hair, skin, and nails, darling. Instagram made it famous, but here's what no one tells you. Too much biotin interferes with lab tests. I've seen false heart attack results, false thyroid readings, all because someone was taking 10,000 mcg a day for beauty. Hospitals have issued official warnings about this. It can make your blood work look normal when it's not, delaying diagnosis. You don't need that risk just for thicker hair. Let's not forget about iron, the most misunderstood mineral of all. People think fatigue equals low iron, but for adults over 50, especially men and postmenopausal women, excess iron is a silent killer. It builds up in the liver and heart, fueling oxidation like rust inside your body. High iron levels are linked to heart disease and Alzheimer's, yet many multivitamins still contain 18 milligrams or more for energy, unless your doctor says you're anemic. Never take iron supplements. And finally, the multivitamin trap. The one that seems harmless because it's just a little of everything. But that's the problem. Multivitamins combine synthetic forms, unnecessary doses, and questionable additives all in one pill. And here's the ugly truth. Studies show they don't extend your life. No, don't prevent disease, and sometimes do more harm than good. I'm not saying vitamins are evil. I'm saying that the way we consume them today, blindly, excessively, and chemically is. You might be wondering, so what am I supposed to do? Just stop everything? Not exactly. The key is understanding what your body actually needs, not what the label tells you. The supplement industry in the US is worth over $50 billion. They're not selling health. They're selling fear. Fear of aging, of weakness, of memory loss. And they package that fear in capsules, coated with promises. But your body isn't stupid. It knows when something doesn't belong. When you get nutrients from food, salmon, eggs, greens, berries, they come with enzymes, cofactors, and balance. Your body recognizes them. When you swallow an isolated synthetic compound made in a lab, it's like giving your body a fake key. It might fit the lock, but it doesn't open the door properly. That's why so many people still feel tired, achy, or foggy, even after spending hundreds on supplements. Let me tell you something else they don't want you to know. Many of these cheap vitamins are manufactured overseas, under different quality standards, then rebranded with Made in USA on the label. They're filled with magnesium stearate, titanium dioxide, and artificial colors, things your body doesn't need at all. Some of these additives can inflame your gut or trigger allergic responses, especially in older adults with sensitive digestion. I've had patients in their 60s and 70s bring me bags full of supplements, literally dozens of bottles. They were taking 20 to 30 pills a day. I remember one gentleman saying, "Doc, I don't feel any better, but I'm doing everything right." He wasn't. He was drowning his system in synthetics his liver couldn't process. We cut 80% of his supplements, replaced the rest with simple whole foods. And in 3 weeks, his energy returned. The truth is simple, but uncomfortable. More isn't better. Balance is. Vitamins are tools, not crutches. They should support your health, not replace common sense. If you eat real food, stay active, manage stress, and sleep well, you won't need half the bottles lining your cabinet. But if you do take supplements, here's my advice. Straight, No sugarcoating. Always choose whole food-based or bioactive forms. Look for words like methylated, chelated, or from natural sources. Avoid anything that says DL, ascorbic acid, or folic acid. And never take a vitamin just because it's trending online. What works for a 25-year-old influencer doesn't work for a 65-year-old heart patient. Your body is wiser than you think. It doesn't need 1,000 shortcuts. It just needs less noise. Remember, the most dangerous vitamin isn't the one you forgot to take. It's the one you take without understanding. I'll end with a story. A few years ago, I had a patient named Carol, 68 years old. Retired teacher, sharp as a tack, but always tired. She came in with joint pain, stomach upset, and headaches. She was convinced something was wrong with her thyroid. Her blood tests, completely off, looked like thyroid disease, but something didn't add up. We retested after asking her to stop her biotin supplement for 2 weeks. Everything normalized. Just like that.